We tend to look out for September, October of every year.
September, October?
Yes, that's because that's when you have, I think, freshers, various balls and activity, freshman week.
Rape, a gruesome and violent crime with long-lasting side effects, is plaguing Jamaica. For years, the crime has been on the rise, threatening the safety of the nation. In 2010, Nation Master, a statistical website which provides collective data from the UN, UNESCO, the World Bank, and other credible sources, listed Jamaica as 21st on the list of countries with the highest rate of reported rapes. While the data may be outdated, the approximation is still relevant. With the lack of information surrounding prevention, recovery, and the reduction of rape, Education for a Better Jamaica decided to seek answers of their own to present to the public. We sent Kimberly Morris to speak to Dr. Rhonda Hutson at the University of the West Indies Hospital to investigate the medical concerns of rape. Dr. Hutson is a medical doctor working in the Accidental Emergency Department, veteran in the care of rape survivors admitted into the hospital.
Rape is actually forced sexual assault or having sex with someone against their consent. It's a legal term. It's defined that way. So we cannot, as a doctor, diagnose rape. Rape is not something you can diagnose, or a doctor or nurse. It is done in a court of law, so it's a legal definition. Yes.
Wait, so in 2010, there were reported 650 persons who got raped. Mm-hmm. And then in 2012, we see an increase to 833 persons getting
mm-hmm.
raped. But many of us know that this is not all of the cases of rape. Why do you think many persons don't report it to the police or to an authority figure?
The factors are many. Persons that we see here usually don't like the process. There's mm-hmm. a certain amount of shame. They fear being tried before they go to court. They may have fears of repercussion from communities. Sometimes they know who has done it, but they don't want to report it. A lot of people just don't like the process. They don't want to go through telling the story several times, and they fear the court process. So for the most part, that is what they will not report it for that reason.
So do you think that the hospitals see more cases of rape victims than what is actually being reported then?
Well, I think not just the hospital, but in general, reported cases are far less, accounting for about a fifth of all cases. It's kind of a figure across the world, maybe no more than about 25% of all cases reported accounts for the actual number of cases of rape, and for some of those factors cited. Yes.
So in the cases where persons come in for rape, how are they treated from the moment that they come in to when they leave the emergency care?
The treatment has, since 2009, varied a little bit, because in 2009 we got kits like this in Jamaica for the first time. We're using kits. So the CISOCA branch would keep the kits. So when patients come to us, two things could happen in general. We refer them immediately to CISOCA. So we will call CISOCA, and they will decide if they come for the person and take them down there. Or if a patient comes in here, but we deem them unfit to travel, perhaps because they have other injuries, or they're in need of care that requires immediate attention, then the CISOCA police will bring the kits, and we will conduct that examination here. Right. So that's it. Generally, that's what would happen, and the process is quite long.
Around how long
well,
does it take?
If done properly, you can go anywhere over 2 to 3 hours, because it's
just for the kit alone.
Just for the kit, just to take a history, to examine, to collect your all the evidence, to label them, and so it's quite involved. It's quite detailed and quite long. Yes. Yes.
So during their time here, do they get psychological evaluations?
Okay, that will depend on how they come in. So not everybody will get or require immediate psychological evaluation, but all persons will get a referral. So if we deem that you're too emotionally distraught, then we can call out our psychiatrist on call, and they will start the process right away. However, what could also happen is that they get a referral. And the referral could either be to your in-house psychiatrist, but more often than not, it's to the Victim Support Unit, which is the government agency, which is on Hope Road.
Oh, okay.
Or Old Hope Road. Right.
What are some of the health risks associated with persons who've been raped?
All right. It varies from, I would say, health risk from let me not trivialize anything, but you can have the sort of things you may think of, infections, right? And HIV, hepatitis, and all the STIs you can think of, they could be exposed to and contract. Then there is the risk of pregnancy, right? Apart from the actual physical injury, so they could have injury to the reproductive system, or sometimes the rape occurs in a setting of other trauma, so they may be battered, right? We've had kidnappings, we've had cases where the throat was slashed, we've had several types, so it depends on the circumstances under which the rape occurred. And then one, I think, aspect that we think of, but perhaps we don't pay too much attention to, is the long-term effects of rape. Because sometimes a woman will come in and have no physical signs at all, but the long-term effect, the emotional, the psychological effects could be quite marked, and can lead from things you call the rape trauma syndrome to full-blown post-traumatic stress disorder, which will probably last you for quite a long time, and that perhaps can be more devastating than having somebody slap you or have a bruise or a cut that we can stitch up.
Do you have a lot of cases with people coming in that have been say given date rape drugs?
Okay. All right. We don't have a lot of people who know that they've been given date rape drugs.
Oh.
Right? What we do have from time to time, and usually there's a pattern to it. So one of the things that we tend to look out for is September, October of every year.
September, October?
Yes, that's because that's when you have, I think, freshers, various balls and activity, freshman week at the two major universities around us. And what would happen is that everybody gets a little excited, and they drink things and they do things that they report to us anyway, that they do. And we've had several cases where persons, usually women, come in to say, look, I want to know if I was raped. Because
they have no clue.
They have no clue. They know they were partying, and then they wake up in somebody's room that they don't know. Or sometimes we've had cases where persons started texting them, boy, last night was good, kind of thing. And they're not sure, is it a prank? Is somebody just trying to mess with them? And they get excited and they come here to us for us to tell them if they've been raped. Of course, I can't tell them if they've been raped. We can examine you to see if there's injury or whatever, any evidence that perhaps sexual activity did occur. But that's as much as we can tell you. So we tend to get that. With respect to drug testing, we would not do it routinely. So if, for example, you say, look, I think I lost consciousness, right? Or if you appear to be particularly drowsy, or you're talking to me but like you're not here, kind of thing, then what would happen is that we might assume that you have had a drug, and it's not necessarily date rape. I mean, that's good, but the sort of things, the commonest drug really is alcohol.
Alcohol.
Yes, despite, and this is anywhere in the world you go, despite the hype about date rape drug. We don't have the one that you see if you watch TV. You'll see date rape, Rohypnol. That's the one that everybody knows about. But things like ecstasy, right? Is here in Jamaica, quite common in Jamaica. The commonest drug rather is alcohol. Either you're drinking it voluntarily in a social setting, or you're made to drink it. You know, somebody knows you really can't take 2 or 3, to make sure you drink 2 or 3. But for the most part, we wouldn't routinely test everybody, right? But we would have some little indicators that, well, okay, maybe we should test you. So cases like that, cases where we've had persons coming in saying, boy, they found themselves in a particular place they shouldn't be, in a compromising position, but they don't know how they got there. And that's typical. They just don't know how they got there. And then we would do a drug test on you at that time to see if there's anything that comes up. Yes.
Right. Is there anything persons can do in those social situations to make sure that they don't take these drugs?
Well, knowing your limits is one. Knowing the people you go out with is another. From when I was a teenager, way back, one of the things that we were always warned about if you were to go anywhere is to ensure that you drink drinks that you see somebody open, rather than accepting a drink that was sent over to you from the bar, that kind of thing. And that still holds. And in other places, they are trying to develop little tests that you can do with coaster size to see if you can test whether or not your drink has been spiked with something. And it has varying degrees of success, but that's not here now. So for the most part, I say, know the people that you go out with, and if you're going to a party with a ton of people you don't know, perhaps you should be mindful about that big bowl of punch that is sitting there inviting you, because it's mixed with a lot of things, and sometimes you don't even know what's in there. And I presume the body system should work, if you're going to drink. And it's not just because you're going to drive home, but you have to think of the possibility of sexual assault.
And safety numbers.
Absolutely. So you have to, general things that you could do, be careful what you drink, what you're accepting from whom.
You don't want to argue, but you feel the world as you know is about to come to an end, and you're tired. Everybody gave you advice, all the family and friends, so you push more, you lose more, don't know what to do. Plus you know it's a lie when you hearing I love you. Everything started so well, but right now it's like hell. You deserve better, oh yes you deserve better. New page, need to turn a new page. Really, really hell, have no fury like this new rage. You don't wanna be a solo singer on this new stage. You deserve better, oh yes you deserve better. So you try and you try, all that happens after that, you cry and you cry. I know you're working so hard, just to make your dream come true between me.
It really is a wake-up call to say this is what could happen, and it can happen to anybody, and rape isn't a woman thing.